LAO.
Karina Hendren, LAO. Our key finding on this item is that the proposed delay in service provider rate reform would help the budget problem, but that alternative approaches could be warranted. The proposal would help address the state budget problem by providing about $600 million in general fund savings in 2024-25. Nonetheless, the proposal does involve trade-offs. The state accelerated rate reform implementation in response to stakeholder concerns about a shortage of direct support professionals, or DSPs, available to provide services. The acceleration of rate reform has not yet been fully implemented, and so some degree of DSP shortage presumably still exists today. If the proposal is implemented, individuals served by DDS might not receive services as quickly as could be possible if the full rate reform were implemented in 2024-25 as under current law. The legislature could consider alternatives, as we noted before. For example, it could target select service provider codes where the DSP shortages are most acute. This would require working with the administration to identify which type of targeted or scaled back approach would make the most sense administratively. And a key point for the legislature to keep in mind is that any alternatives still require dollar-for-dollar solutions elsewhere in the budget. The LAO is available to assist the legislature in identifying alternatives, and our office can provide technical assistance in evaluating trade-offs. Thank you.
Next.
Good afternoon, Mr. Chair, Assemblymember. My name is Barry Jardini. I'm the Executive Director with the California Disability Services Association, also one of the 3 co-chairs of the Lanterman Coalition, representing a statewide coalition of stakeholders. Honored to be here today. Thank you for the invitation. Appreciate the comprehensive agenda, Ms. Vasquez, as well. I think we sit here recognizing the very difficult budget situation in front of us. I don't think we come to this conversation ignorant of the fact that you all have to make very difficult decisions around where to spend state resources that are inadequate to meet the demands of all of Californians. So that requires us to really take a strong look and see where are those dollars going to be most meaningful, where is the need most acute, and we believe that this proposal, while it would save general fund revenues, is the wrong decision for Californians with intellectual and developmental disabilities, the workforce that serves them, and the family members that love them. We have made some significant progress in stabilizing the lives of individuals with IDD over the last couple of years. With the first 2 stages of rate model implementation, we have helped edge our way out of kind of the COVID nightmare. As it's been noted already, the acceleration was predicated on a dire workforce shortage. Our information showed that 1 of every 5 DSPs had left the system during the pandemic, and we wanted to find a way to bring them back. So the administration, legislature came together and wisely made the investment to not only fund the rate model implementation, but also to accelerate it in response to the need. That need has not gotten any less acute. While I could say we've made some progress, and we've been able to hire a little bit easier with those first 2 stages of rate model implementation, this last stage is the big one. It's the one that's supposed to get us to market rates, something fairer and more competitive that will allow us to compete with other workers in other industries, and I'll touch on that in a moment. But I think it's also important to just remember our history a little bit, and I know some of this has been covered. The rate study was done because the legislature pushed for it after advocates said, we're underfunded. We said, let's validate that number. It found that we were underfunded by $1.8 billion annually. So this system has given back for decades. Right? We have given back since the rate freezes. Every year we have not been fully funded. It's been a savings to the state of California and the people who feel the impact are people with developmental disabilities every day. And so looking at this proposal, while we understand why we're sitting here talking about it, it doesn't hit very comfortably when it means real things to real people who need the services. And I want to touch on just the individuals impacted by this proposal and why we're opposing it. Individuals with IDD, their lives are destabilized. Today, even with the progress we've made, we still see waiting lists for services. Individuals referred from regional centers to providers who say, we would love to serve you, but we don't have the staff to do it. We have individuals who are in program now who are effectively getting ration services in some cases, where they're authorized for 5 days, but they can only come to program 2 days a week, meaning the other 3 days they're at home, or maybe you can only come in the morning, and the other half of the folks will come in the afternoon. This is strictly a workforce problem. We are in the people business, people serving people. We need to be able to fund the services at an adequate rate to recruit a workforce to make sure that we honor the Lanterman Act. We're the only state in the nation that has an entitlement to services for individuals with IDD, and I think everyone in this room should be immensely proud of that. I hear from colleagues in other states and hear about their allowable wait lists and feel very fortunate that I work in California where we honor the lives of people with IDD. But to do that, we have to nurture it, we have to foster it, we have to fund the system adequately to make sure that we're living up to that promise every day. In order to grow and move forward, it's going to be absolutely imperative that we fund the system. It's the foundation, bringing the funding in, and so we can talk about all the great reforms, the great work the department's doing on initiatives to address workforce challenges, to work on quality outcomes measures, et cetera. But we must make the investments so that we can build, because without a foundation, it's very difficult to build. I want to note just a couple of other quick things around the workforce. DSPs do amazing work. They do it every day. The measure of quality, the best measure of quality is with a competent, stable DSP serving an individual with IDD. That point of interaction and a stable and great relationship there is going to lead to the best outcomes. That's not to say it's the only outcome measure we should take into account. It's not the only metric, but that is fundamentally when the system works best, that's what's happening. Right now, the workforce is struggling. They've expected perhaps wage increases to come with the July 1st increase. Organizations have budgeted to provide those increases to their workers, and now they are looking at a potential 30-month delay between the second stage of rate model implementation and the final stage. In that time, the fast food workers minimum wage is hitting April 1st, taking fast food workers up to $20 an hour. Healthcare workers minimum wage may well go through, depending on the budget conversations this year. All the while, DSPs are looking at wage expectations in the rate models, $15, $16, $17 an hour. Some of the wage models are below minimum wage, and I know the department's investing to address that. But it just doesn't feel right when DSPs who are doing this critical work are being underfunded and aren't being at least able to compete with workers in fast food. Nothing against fast food workers, but DSPs deserve a fair wage for an incredible job. So I just want to leave it with this. Dr. Jackson, you started this hearing talking about the risk that we take. If we don't invest, we actually move backward. I fear that the risk of not moving forward with the currently enacted rate model timeline risks undercutting the progress we've made over the first two stages. It means rebuilding. We've already spent a decade coming out of a great recession to try to rebuild. We're building back up towards it. But this delay could really hurt us and really hurt people with developmental disabilities. And so I appreciate your consideration and the opportunity to be here, and I'm happy to answer any questions you may have. Thank you.
Good afternoon. My name is Amy Wesling. I'm the Executive Director of the Association of Regional Center Agencies, also known as ARCA, which supports and works alongside all 21 of the state's regional centers. I'm also one of the co-chairs of the Lanterman Coalition. And I appreciate the opportunity to be here today to share the regional center's perspective on the proposal to delay the last phase of the rate implementation. As has been noted, California has a unique in the country entitlement to needed developmental services that was established in the Lanterman Act and clarified in the ARC versus DDS lawsuit in 1985. That entitlement belongs to the people we serve. It belongs to the individuals and families, and we all collectively carry out this mandate in collaboration with our service provider partners. Historic rate underfunding has made it challenging and at times impossible to carry out that responsibility. The rate study once again promised to connect rates for services to the cost of delivering them, and especially the cost of developing and maintaining a direct support workforce, which is the linchpin of service delivery, and as Mr. Jardini noted, one of the strongest determinants of quality. There's no question that the labor market shifted dramatically during the pandemic, making it even harder for our service provider community to recruit the staff necessary to provide people with the services they need and are entitled to. And this has resulted in wait lists and rationing of available services, as was noted, for instance, providing 2 rather than 5 days per week of daytime support. This means people cannot use all of the services the Regional Center has agreed to fund, and at times are offered less than ideal services to fill in the gaps. Let me be clear, no one is pleased with that reality. 2 factors make this even worse. First, the population in our system is growing incredibly quickly at a time when California's state population is stagnant. This means we're doing a better job at finding and identifying and onboarding people who desperately need support. But having a system that has grown 31% from a population basis just since 2019 means we need to not only maintain the service providers that we have, but we have to grow capacity. If we maintain the capacity we have, we're already way behind. And second, unfortunately, as has been noted, many of our service providers must compete with the fast food industry for workers. The minimum wage for fast food workers will increase to $20 per hour effective April 1st, and that's a wage that's higher than assumed for DSPs in the fully implemented rate models. And we're now only halfway to implementing those rate models. Without the implementation of the final phase of the rate models in July of 2024, as currently expected, our service providers cannot secure the workforce they need to meet the needs of those already in the system, or of the additional 30,000 people and families we expect to add in the coming year. Without adequate funding for provider rates, the developmental services system cannot keep its promise to provide people with the services they need and are entitled to, and for that reason, ARCA urges the members of this committee to reject the administration's proposal in this area. Thank you.
Good afternoon, committee chair and members. My name is Mark Bansen, CEO of the California Community Living Network, CCLN. I learned today that Director Bargeman and I started the same year in our careers in 1985. And apologies if my testimony sounds duplicative. CCLN is a statewide membership association with approximately 100 organizations, large and small, across the state of California. Our members provide specialized services that support California's diverse IDD community to live more equitable and inclusive lives. Our members provide supported living services, independent living services, employment services, coordinated family supports, personal assistance, respite, and we do housing advocacy. There's a famous quote that quality is defined at the point of interaction between the staff member and the individual with a disability. CCLN strongly supports the initiatives to identify quality indicators, quality measures, and quality incentives. People receiving services and their families deserve and should expect nothing less than the highest quality of services. While there's been progress made towards these efforts, there still remains work to be done, but we've got to start somewhere. We echo the previous testimony that highlighted the DSP workforce shortages. We're desperately struggling to attract, retain, and engage a sustainable workforce. We are nothing without our dedicated, passionate, and adequately trained employees. The current shortage in the direct support professional workforce has reached a critical breaking point. People are facing long delays in receiving services or going without services altogether. Providers are struggling to engage job seekers to enter the field of the direct support professional for Californians with intellectual and developmental disabilities and their families. This will only get worse as other statutorily required increased minimum wages are set to increase in April of 2024. If this delay stands, as of July 1st, 2024, minimum wage earners in the fast food service industry, yay for those folks, will be earning a starting wage that is $6,400 more per year than we're currently funded to pay our direct support professional staff. This essential workforce is being lost. In the 2019 Department of Developmental Services rate study provided a solid roadmap to evaluate service provider rates. A delay in implementing this year risks a delay for delays in future years. It's 2024, and we're talking about fully funding a 2019 rate study 5 years later. Administrative delays and the lack of required updates to rate models are undermining the value of the rate study before it's even fully implemented. These rate models are a critical tool for you all, the legislature, to support the provision of measurable quality outcomes for people receiving services and their families, the sustainability of the direct support professional workforce, and the system's capacity to ensure that individuals from all backgrounds have equitable access to the highest quality of services. Implementing the rate models is all about direct support professional wages. Providers simply can't wait any longer. If they can survive, service providers are very eager to demonstrate quality and achieve their fully funded 2019 rates. Supported living providers and other residential service providers are already being hit as of Jan 1 with a new unfunded mandate, SB 616, a bill which increased sick time from 3 to 5 days for employees working 5 days or 40 hours, whichever is greater. That typical work week is not a typical work week for us. Failure to comply will result in a PAGA lawsuit, Private Attorney General's Act, which will be catastrophic for providers.
Thank you very much. Mr. Lee.
Thank you so much to all the presentations and all the panelists. At some point when it's appropriate, LAO, you keep alluding to having alternatives. So if there was any way to elaborate alternatives, I'm not sure now. But if you have alternatives, we are always all ears to alternatives to budget solutions. But I do want to ask the administration this, and we hear this in various different budget committees and settings that you said, this cut is happening because we need a budget solution. But that's math. The budget is about the prioritization of social values, and if you wanted to achieve the same mathematical calculation, you could close some empty prisons, you could not expand some freeways, you could stop tax subsidizing people's second houses. I mean, those are all things that are in the budget today. So I want to ask the administration, why is it that you looked at this one to delay the implementation? Is it because there was a 600 million mark that we could save some money, or is there a deeper rationale to this than math?
Thank you, Assemblymember Lee. Chris O'Neill with the Department of Finance. As has been the theme, as you alluded to during this budget cycle, it's been about the proposals before you reflect difficult decisions and in weighing the different competing demands. And the administration understands the concerns of the community, has been engaged in conversations with stakeholders throughout the onset of implementation. And we'll just reiterate that the administration supports this initiative, and the proposal to delay is driven by the budget situation, and that due to resource availability. But again, the administration is committed to continued partnership with the legislature and stakeholders to reform the DDS service system in a way that's outcomes focused and centered on helping every individual achieve their.
Sure, I understand that, but what metrics or outcomes lead you to say this is the thing that we target versus something else, even within the DDS world?
Assemblymember, this proposal is driven solely by the budget situation.
Okay. So. All right, thank you.
I think it's going to be very important for us to recognize that given the level of uncertainty and fragility of the workforce, and given the continued economic pressures of less skilled, but yet more profitable job opportunities elsewhere, poses a great threat to our system. Mm-hmm. And if we don't have the workforce that we need, therefore we will be at risk of having this community fall into greater instability. And due to that, and due to my firm stance on not doing things that will put us at risk of further instability, this committee is opposed to this proposal. But we are looking forward to finding ways to, if we cannot fully implement the next phase, that we don't do a full pause, but we keep moving forward. I believe we need to have all options on the table until we absolutely have to make a decision. But let me be clear, I haven't found any good news yet in the budget either. But we want to make sure that, again, we do not make the same mistakes that we made during the Great Recession, but that we are as surgical as possible, and that we are not making decisions blindly or in a way that causes us to make rush decisions. I have a question for the panelists, and I think the first question would be, are there any alternatives? Or will you be willing to provide this committee with alternatives to a full alternative to a full delay that will also, in many cases, will be able to bring down some federal dollars with that as well? And this is just a question for all the panelists.
Thank you, Mr. Chair. And the department is open to those ongoing discussions to provide technical assistance on specific options.
Mm-hmm. He'll get to you.
Great.
Oh, it's not. I'm not good at microphones. That's all right. People just trying to figure out how to make this stuff
There we
work.
go. Mr. Chair, thank you for the question. I mean, I think obviously our position at this point is to try to hold the line on the July 1st, 2024, but I think acknowledging the budget may not get better and it may get worse. I think we're very open to providing technical assistance and support as necessary to come up with some viable alternatives. I will note that the rate study found fairly comprehensive and across the board underfunding for services. So from a implementation perspective, I think carving out particular service lines as opposed to finding ways to make progress across the board for all services could be problematic. But again, we are available and willing to help as much as possible on the technical assistance front.
Assemblymember Lee.
Yeah, I just wanted to clarify too, because there is a federal component to this. What generally is the rate of reimbursement for every one state dollar? What is the amount of federal money that we get leveraged back? I don't know who would be best to answer this question.
Could you repeat the question? I want to make
Right. So as I understand with our rate reforms, there is a federal component to this. It's the reimbursement rates. Yes, reimbursement rates. But it's I don't understand what the rate would be. So for every one state dollar, how much or how many cents or dollars back do we get from the federal government?
Sure. For purchase of services, the share of federal reimbursements is approximately 40% of the cost of purchase of services. That ends.
40%. So
Yeah.
for every dollar, it's 40 cents back.
For every dollar, 60 cents is general fund, 40 cents is federal reimbursements.
Okay, that makes sense.
All right, public comment, family and clients, you may begin. 2 minutes. The pressure.
The pressure. First of all, I want to thank you for the opportunity to share. My daughter Haley, behind me, is a recipient of services provided through the Regional Center. She is 29 and has had 29 surgeries to date. We never thought it would be possible for her to live on her own, but thanks to these services, it has been made possible. One of the many services funded by the Regional Center is CVS, Community Vocational Services. It has been life-changing for us. It has been instrumental in Haley's independence. This program actually gives her a sense of purpose, a reason to get out of bed every morning. It helps her to know that someone out there other than family actually cares. It gets Haley out in the community, learning life skills, learning job skills, volunteering, and doing life like the rest of us. It helps me, as her caregiver, to know that someone other than me reaches out to her each and every day. If it weren't for this program, I'm sure she would have succumbed to depression due to isolation. So many of our disabled population are ignored and isolated. They didn't ask to be born that way. They deserve the same opportunities that the able-bodied population does. They deserve to feel valued in our community. CVS makes them feel valued, gives them a purpose, treats them with the dignity and respect that we all deserve, and shows them that they are worthy. Just last week, Haley, along with a group from CVS, was feeding the homeless. They have been making an impact on the community. Please do not hold back the funds needed to continue these programs. They're detrimental for the disabled community and their family members. Thank you.
Thank you. Next up, and please state your name.
A little bit lower, thank you. Hi, I'm Haley. I wanted to say that I absolutely appreciate having the CVS Community Vocational Services program, and I know a lot of other people do too. This program brings so many people independence and a sense of purpose and belonging in the community. It gets people out of the house, and it's good for our mental health. The CVS program is important because it teaches us job skills and life skills. I don't know if many of us would be doing much with our time without this program. We have more fulfillment being a part of something like this. I really enjoy being so involved in this program, and I love that I'm out Monday through Friday engaged in the community. I'm with people who are similar to me, and I get to connect with others. I have learned a lot in this program, everything from strengthening math skills to learning more social skills. I also love the physical activity. We're engaged in the community every day, so we get around a lot. We experience so much too. I've enjoyed learning new skills and gaining further independence. My confidence has grown a lot being in this program. I know this goes for a lot of the others too. Thank you.
Thank you very much.
Hi,
Please state
thank
your
you.
name.
I'm Kelly Pennington, and you've heard a lot about self-determination today, and I'd like to talk to you about why traditional services work for me. I was 25 when I had my first son. Bradley was 8 weeks premature. We were told that he would not leave the hospital. He did. Then we were told he would not walk or talk. I was young, terrified, and a first-time mom. I brought my baby home with a trach, on a ventilator, oxygen, 21 meds, and continuous G-tube feeds. Meeting developmental goals was not even on my radar. I spent my days fighting for my son's life. Thankfully, we were referred to Alta California Regional Center, and I got an amazing service coordinator. She came into our lives. She provided physical therapy, occupational therapy, teachers, speech services, all in my home so that I didn't have to lug my infant, a nebulizer, a suction machine, a breathing treatment machine, and many other apparatus that I can't even think of right now. Because of these early intervention services that were provided through the regional center and the management of the regional center, I would like to introduce you to my walking, talking, thriving son.
What's up, man? I remember you.
It's good to see you, Dr. Jackson.
How are you?
Good, doctor. How are you?
I didn't know you were going to be here.
I've been sitting back there this whole time.
Oh, man. All right.
All right, doctor, let's get this over with because about half of us are probably tired. Hi, thank you for allowing me to speak. I am Bradley. I am a 30-year-old self-advocate with intellectual and developmental disabilities. I got to go to an amazing day program where we learn things like shopping, budgeting, job skills, and even public speaking. We work in the community at Meals on Wheels, Chicks in Crisis, and Project Ride, which is a therapeutic writing program for people like me with IDD. At my day program, Vicious Emotions, we are part of our community, and that's really what me and my friends want. We want jobs, friends, and our own apartment so that we can live the way we want to, much like the great folks here tonight. The regional centers make sure that I can live the way I want to, just like all you get to live every day. Thank you for your time.
Please state your name.
Good evening. I'm Jan Brown. I have a son that's 41 years old, and he suffers from autism, life-threatening form of epilepsy, and he has very severe behaviors. We basically started our journey, well, basically 10 years ago to try to get him in supported living, because we know that if we didn't do something like that, he would end up in a DC center. So it took us 10 years. We were put off a lot. And then finally, when I walked through the door at our regional center with an attorney, we got that service. But it didn't go very smoothly because it took over a year and a half for somebody to finally step up to the plate because they felt our son was going to cost too much money to support in supported living with all of his medical issues and his behavioral challenges. So we finally did have one supported living company that did support him, but it didn't go well. So long story short, we asked them to please give us a little bit of insight on it because my husband and I have never run a business. So we came up with our own agency, and basically we were really, really struggling for over 2 years because when we started, we got $17 an hour to have staff come in. You're talking about supporting a person that needs 2 staff for every shift and has high levels of behavior. We had to compete with a fast food chain that had signs in front of their establishment that they would hire you and train you at $23 an hour. So obviously, I mean, we couldn't compete with that and we almost shut down. Later on, we were able to, after we ran the business and we run a very tight ship, we were able to pay $19 an hour, which is still way too low for somebody with all the challenges our son has. And basically, we offered medical insurance. I thought, oh, good, this will be a real good thing to do so we could keep and retain staff. We still had a revolving door. So finally, another 2 years went by, and I told my caseworker, we can't keep going like this. It's too much. My husband always has to fill in shifts. My manager always has to fill in shifts. And I was told by somebody, maybe you should try to do a health and safety waiver. When I talked to other agencies, they said, oh, you'll probably need to get an attorney. So I dug into it, my husband dug into it, and thank God we did it, and we got the higher rate to make us competitive, and especially more competitive than the food establishments around us. So right now, we've gone for 6 months without a revolving door. It's been a blessing. You have no idea how much the cost is to hire people, to put it out there that we're looking for applicants, and the strain is enormous. So I hope that they're able to, not cut the budget. It would be devastating, especially for clients that have higher needs like our son. Thank you for your time. I really appreciate it.
Thank you. Next, please state your name. Remember, please try to keep your comments to 2 minutes, please.
2 minutes. My name is Pat Hornbecker. I am president of the board of directors of the ARC of California, and I'm a mom. I'm Joseph's mom. He is 43 years old, has Angelman syndrome, and lives with 24/7 support in San Francisco, California. One of the things that makes me proud to be a Californian is the Lanterman Act. This is my copy of the Lanterman Act, well worn, well used often, and this is my son's copy of the Lanterman Act, also used by many of the clients that you see and the families that are standing behind me. I want you to remember that it's a promise. It's a promise from the state of California to all people with IDD that they have a right to receive the supports and services necessary to help them live a life to their fullest potential in the communities of their choosing. Over the last 55 years, we, the disability community, who are standing behind me and stood here for the last 6-7 hours, have survived recessions and droughts and a worldwide pandemic with cut after cut after cut, never being fully funded. That is dedication from our families. But now we have this biggest hit of all, of over $1 billion, couched as a delay after we, in good faith, endured a rate study survey, which is now 9 years old, and was based on bad data from DDS and regional centers, versus the frontline service providers and small businesses that actually deliver the services in sports in California. Even the department finally agreed that the data was dated and inaccurate. And still, the study proved a $2.2 billion gap in funding. We reluctantly agreed to a slow implementation plan, which is now being delayed. Make no mistake about this, the delay tactic by the governor is a cut. And to our system, to the small businesses that drive the system, and to the lives of people with IDD in California.
Thank you.
It is a broken promise. And why us? Why have you done this to us? You made a promise in 1969 not to do this and recognized that people with IDD deserve the respect and dignity of a life equal to every other citizen in California.
Thank you.
So what do I tell my son? What am I going to tell my son that thousands of service providers and small businesses across the state, I've been sitting here since 11, so I'm just going to tell you that, what am I going to tell my son when I go home tonight? That these service providers are going to close, that hundreds of thousands of DSPs who work for pennies on the dollars are no longer going to be there? And now we've got a master plan. You know what? This is the master plan. We have a plan. And there's probably some master plan written on somebody's desk already, but it'll take years to write, and the one they did for the Department of Aging has a 10-year implementation plan. 10 years. So even if you do a master plan, it's going to be 10 years before it gets implemented. That's even worse than a 1-year delay on the rate study. This is a humanitarian crisis, in using the governor's words. So listen up.
Thank you. Next up. Next up, please state your name.
My name is Erica Kocha. My story with the Regional Center started in 2016 when my first son was diagnosed with ASD. I was a scared mom who didn't know anything about the disorder, let alone how to go about getting my boy the help he so desperately needed. He couldn't speak, he would rectal dig and smear, pull out his own hair and bite himself. I contacted Alta Regional Center in Sacramento. I was educated on what it was thoroughly. I was given a plan, which might seem like a really simple word, but to someone completely lost, that word meant hope, relief, and happiness to my family. From there, my family made a move to Crescent City, California, and to my absolute amazement, the Redwood Regional Center was right there. They coordinated getting my son set up with all of the services and continued therapies that he still does today. In 2021, I adopted my second son through a family adoption. He was born tox-screen positive and with tracheomalacia. Who do you think was right there to guide me exactly through what to do? Who do you think helped monitor my boys grow? The regional centers. They're more than just another expense. They're a guiding light, to echo what others have said, a refuge and a literal lifesaver, because mental health is also a crisis, and a mom dealing with all of those things definitely suffers. A mom, a family, grandmothers, their other siblings. I found out about this meeting on Monday and packed all 4 of my kids in the van and drove over 400 miles and 7 hours to be here. I've been here since noon. That's how absolutely critical this is to me and my babies. And speaking on that matter, this is just another reason why telehealth and the ability to Zoom these kind of things is so important in this community. Please think about this the way that you would if you had somebody with special needs in your family. You guys talk about how it's not numbers, it's individuals. These are the individuals right here, okay? Suffer daily, but with the added help and the resources and just the support that we get from our coordinator, the entire thing, I mean, even when the pandemic happened, they were just absolutely wonderful. You know what I mean? Like, how many things can you say about that through the pandemic? This is so important. It cannot be ignored. And this kind of things are the tipping points of where these kind of things start to just go away through the years. It's just what's going to happen. So let's not let that start. Let's not start that slippery slide, that slippery slope. I really appreciate that you pointed out that seems like you really have a vigor to want to create that master plan and to get in there and dive deep and really pinpoint some key things that need to be changed. I really hope that you follow through with that. Genuinely, we're all human. We all have a lot on our plates. We're all doing the best that we can. But I know statistically, one of you up here has somebody with autism in your family. I know it. Or you know somebody, a family friend, someone. Please, Do everything that you can, because it's not a whole you're affecting individuals. And you have no idea the detriment that you can cause in people's lives. Thank you.
My name is Veronica Vasquez, and I have a 20-year-old son who was diagnosed with autism when he was 4. I remember walking out of the Mind Institute, holding his hand, looking at his little face, knowing full well he was going to need my support in order for him to live a successful life. At the time, I didn't know what autism was, so I reached out to his pediatrician, and her words exactly were, "I don't know much about autism, but I could prescribe anything you ask for." From there, Far Northern Regional Center became my safe space. With the support of the service coordinator, I was able to connect with other service agencies such as Ralph Family Empowerment, who provided IEP training, advocacy. They helped empower me to be able to advocate for my son during IEP meetings. School services and services provided by Far Northern Regional Center have helped my son become the independent adult he is now. He's always loved balloons, and his obsession about balloons grew so much that we decided to open a small business, a balloon store, in the small town we're from in Gridley. This would not have been possible without the support of Far Northern Regional Center and his personal assistant, who is by his side helping increase his social skills, helping him learn how to run a business, take orders, communicate with customers, and make beautiful balloon arrangements. He's also attending Butte College, taking 2 classes at a time, and is set to graduate in May with an associate degree. This is all thanks to him, his family, and the services provided by Far Northern Regional Center. Thank you.
Thank you. Come on up, please state your name.
Good evening, Committee Chair Jackson and the Assembly. Thank you for waiting all this long. My name is James Gonzalez. I'm the proud parent of Santiago. We affectionately call him Ago. I have shared a photo with him, with you guys, as well as some of his artwork. As you can see, he's very talented. And yes, his favorite movie is Cars. My son Santiago, he's 19 years old. He's been a regional center client, San Diego Regional Center client all his life. I'm also president of Autism Support of Imperial County. You can see I'm wearing the patch on my chest here. We provide services. We provide information for parents and professionals about autism. As you can see, I'm a little nervous, so I'm breaking up a little bit. Apologize.
Take your time.
You know, it's not every day you talk to the Assemblyman. I'm here today to provide you with a brief testimonial about what San Diego Regional Center has meant to Ago and our family. I'm not able to think of a world without San Diego Regional Center or any of the regional centers. They provide services that improve the quality of life for my son Ago and so many other families in our community. Ago started receiving 15 hours of applied behavioral analysis therapy, ABA for short, per week, and was receiving also respite services and other supports from San Diego Regional Center. These invaluable services have improved his life that no metric can quantify. Just like Ago, there are thousands of individuals with autism and other disabilities that require ABA services, respite services, and all the other services that San Diego Regional Center and all the regional centers provide. ABA therapy is one example of the many services that San Diego Regional Center and all the regional centers throughout the state provide to their clients through the Latterman Act. Committee Chair Jackson, I don't mind as a parent sitting down with you and discussing all these services with you anytime. On behalf of my family, Autism Support of Imperial County, ASIC for short again, we want to express the appreciation that San Diego Regional Center has done for my son and for the community, the support and the sponsorship. And if you're interested, my group is having an autism fair in the city of Imperial on April 6th. You're more than welcome to come from 12 to 5 and meet families in our community. Get to know them. See all the service providers that we bring out there for them to meet, to get to know, to see what services they can apply for and what they can get from the service providers through San Diego Regional Center. see it. See what our parents can get and their families and their children. And you know what this means. I came from El Centro, California, farthest south you can get without going into Mexico, outside of San Diego. I missed my flight today, home, because that's how important this is. I just don't know what to say. Thank you.
Thank you. Thank you for being here. Next up, please state your name.
Hi, Whitney Petri. I'm a mom. I think I'm the end of the client family break. So we're getting there, which is good news. I hear screaming, hungry children. I'm there too. I lived in Washington State with my kiddos, and my eldest kiddo was getting kicked out of childcare, his preschools, and I couldn't even get a referral for a diagnosis. Got a job in California. Regional center set him up. We got a diagnosis. It was amazing. Unfortunately, we were in a rural county here in California, and the school was trying to kick my son out. They had the police coming and putting him in cuffs. He was coming home bruised. They took him to the hospital and sedated him without letting me know. I had nobody in the community, and I mean nobody, to advocate for us except for Regional Center. When the whole community is against your child and there's nobody. We were fortunate. We moved away from there to a different part of California. My son is now transitioning to high school, a new school for the first time in 6 years. He's been excelling. He's doing really good. But when you move to high school, your IEP team, the people who know your son, don't come with you. You know who comes with you? Your Regional Center advocate. I'm scared. I'm scared of high school. I'm scared of what could happen again because of what I've experienced in rural counties here in California. And I need my Regional Center people. And, Regional Center, they provide the consistency, resources, and advocacy when no one else does. I do want to echo what other parents said. There was a lot of people in the hall. Mm-hmm. There was at least a dozen with visible disabilities, including wheelchairs. Mm-hmm. We got to do better. I know you guys are helping us and working to not have the governor delay this, but we need wheelchairs to be able to get in here so they can self-advocate. The people you're hearing from are the parents with endless patience. We got to do better. All right.
Thank you. I agree. Thank you so much. Are there any other family or clients at this time? If not, everyone else, come on up. Please state your name and affiliation.
Hi, I'm Nancy Seager, and I'm from the Infant Development Association. Mm-hmm. So IDA, Infant Development Association, strongly urges rejection of the delay in the increase for early intervention providers and asks the state to fulfill the rate increase as promised. We are compelled to advocate for the implementation of the rate model so that staff members are properly trained and compensated for their work, so that quality and accessibility of service is strengthened, and so that we can support the health and well-being of children.
Thank you.
Thank you.
Next up, name and affiliation, please. Name and affiliation, please.
Hi, good evening. My name is Stacy Martinez. I am very proud to be the executive director of the ARC Solano. Our small agency provides supports to adults with developmental disabilities in Solano County. I would like to urge the subcommittee to not delay the rate implementation to the next fiscal year. I believe a large part of my job is to ensure our program participants have an equal opportunity at achieving a desirable quality of life, just as you and I have. But to have this opportunity, our consumers need the supports that we as providers provide. Good service providers can help provide equity in the community for our consumers. Providing poor supports is easily done with our substandard rates. To attract desirable employees, we need to offer adequate pay, good benefits, high-quality training and professional development, as well as sufficient infrastructure to support our DSPs. In addition to the lack of qualified staff, community integration is not free, it is not cheap. However, it is expected of all service providers. we get audited on it. Our rates don't just pay for our DSPs, they also pay for what we do during program. I don't want my programs to just print out coloring sheets or walk around Costco and eat free samples. And even that is not free because we still have to pay for the printer, the paper, the markers, and the transportation to and from Costco. Instead, I want to take all of my day program to Oakland's History of the Black Panther Party Museum tomorrow as our final celebration of Black History Month. However, I can only take a handful because of admission and transportation fees. I've leased a variety of curricula for my staff to use so they can teach meaningful concepts like executive functioning skills, plus academic subjects and life skills training. But these yearly lease fees can get overwhelming and we've had to cancel some. Quality of life is not just an issue for our program participants, but also for my staff. The majority of my staff, including half of my management team, who make higher than minimum wage, have second jobs to make ends meet. They are exhausted and we're all exhausted, but we do our best to provide the level of service our participants deserve. Thank you very much for your time.
Thank you. Name and affiliation, please.
Thank you. Good evening, Rachel Libert Lewis on behalf of Easter Seals Northern California. I promise to be brief because you've already heard a lot of really powerful testimony tonight and I know everyone is tired. Nevertheless, Easter Seals Northern California wants to express our deep concern about the proposed budget delay. We think that it's going to exacerbate the existing workforce shortage and access crisis that you've heard about so much over the course of the last 6 hours. We're also very concerned about the signal that comes from the state continuing to delay funding and underfund these programs. The IDD community is already extremely marginalized, and we're afraid that this signal indicates that that's okay with the state, and we can't stand with that. Thank you.
Thank you. Name and affiliation, please.
Sarah Verity, representing Ability Path. Thank you for the hearing today, Chair Jackson and staff. Ability Path is a 104-year-old organization providing a lifespan of services from infancy to seniorhood in San Mateo and Santa Clara counties. Cost of living is high. And my organization has 50 open positions right now, and if we filled those positions, we'd be providing services to hundreds more Californians with IDD. We're not alone. 95% of organizations like mine report being severely understaffed. Approximately 70% of those organizations are closing or discontinuing programs, and our waiting lists continue to grow. I ask that you reject the governor's proposal to delay the rate model implementation. Californians with IDD can't wait until 2025, and with their entitlement, they shouldn't have to.
Name and affiliation, please.
Hi, my name is Eddie Esquivas, and I represent Manos Home Care. We provide respite and ILS services to approximately 2,000 individuals. And this proposed delay would destabilize Californians with developmental disabilities, their families, and the service systems that supports them. It will decrease the service that they need with staff turnovers, and more vendors will be forced to ultimately close the doors, as we saw with the delayed ILS rate fix with AB 1568. Currently, our organization has 150 different individuals waiting to be on our wait list, because we're unable to keep up with the staffing demands. They remain on our wait list because other vendors are also at capacity. By not receiving access to these services that they need now, it will lead them to require more intensive and expensive services later in life. It is less expensive to continue to invest now rather than to add additional funding later to rebuild the system after it erodes. Californians with disabilities are counting on the legislature to deliver on the promise in the Lanterman Act. Please reject the proposal to delay the rate model implementation. Thank you.
Thank you very much. Name and affiliation, please.
Yes, hello. My name is Alex Mountford. I'm representing Respite Services as the president of the California Respite Association. The Respite Association agrees with the motions to continue to implement the rate study and also ensure that there are quality measures to ensure services are doing what they're supposed to and the individuals that we serve are getting the quality supports they need to live fruitful lives in the communities. As Barry Jardini mentioned earlier too, there are services that are being recommended to be funded at with the assumption that their pay rates for DSPs are below the established California minimum wage. Respite is a core service where that is a fact too, and for many regional centers, the rate study assumes that providers are paying DSPs $15.33, that's 67 cents below the minimum wage. This is a critical issue to ensuring the sustainability of respite services, which we've heard that a large number of folks use and greatly benefit from. The California Respite Association is happy to provide any supports needed to address this issue, as it's a critical component of implementing the rate study and following its intention. Lastly, I'd like to voice my support in repealing the Family Cost Participation Program. As we've heard from many people too, the barriers and the distrust that things like this can cause with the regional center is detrimental in ensuring that the Californians that we attempt to serve and support in the best way possible no longer trust the service system that's there to do that intention. I thank you for your time.
Thank you very much. Name and affiliation, please.
Tony Anderson, the Association of Regional Center Agencies. And thank you, Chair Jackson, and all the staff for staying up late with us tonight. I'm not going to cover all the things that you heard from the regional centers already. I appreciate our time already, but there are a couple things we missed. I wanted to make sure that I touch on them. One, you just heard about the Family Cost Participation Program and the annual family fee, program fee. That's something that regional centers have been pushing on for quite a long time to stop, to get rid of. It's been on pause for a while during COVID, and now the administration is coming forward to stop it, to eliminate it. So we're very thankful to the administration for that proposal, and so we want to give the kudos there, and also we want to urge your support for that measure as well. The other item was the self-determination program, the participant choice specialist. We had a very nice, thorough analysis of that in the report. This is a very important piece for us to move forward with self-determination. I know it was temporary in the beginning. We wanted to see how that would work and then move forward. But this program is very complex. It doesn't need to be this complex, but for a variety of other reasons, we have all worked very hard. We have found problems along the way, made the fixes. But these are the people inside the regional centers that really help us promote self-determination amongst other case managers and also amongst our community. So we really need them. And so our ability to run that program and move forward with it in advance depends on them being there. And then finally, there was a discussion today on the equity issue. And I found that fascinating. I really appreciated your comments and the dialogue. I thought that was great. The one thing that I did miss in that was that the regional centers have this wonderful program. The department put this forward called it's enhanced caseloads. And these are these small teams. At the regional center I was running, we had 6 people, and they were service coordinators, but they have really small caseloads. And this is throughout the state. So very small caseloads, monolingual Spanish-speaking families. And part of that whole program is to tell them about what all the services are, why they might be beneficial, but to have that dialogue with them. So it is leaning in to the Hispanic community that is not receiving any services at all. So we even pulled that out. And we really are focused on what would it take to support these families. And so that's a really important program that started in East Los Angeles, and it's spread throughout California. All the regional centers do it. So I couldn't leave without letting you know more about that. Thank you.
Yeah, thank you very much. Next up, name and affiliation, please.
Hi, well, it's not the afternoon, it's the evening. Good evening, everyone. My name is Tamika Hill. I'm the Executive Director for the ARC of Fresno and Madera counties. Several of the individuals that have spoken tonight have received services with us, but are also competitively employed with the ARC as well. They have shared how impactful their services have been for them as they reach their goals. Their stories are the stories of hundreds of thousands of Californians. The proposed delay to the remaining rate study implementation places the future of Californians living with intellectual disabilities in jeopardy. Unfortunately, the system has faced decades of underfunding, a company that with COVID, our workforce has been affected greatly. Many agencies like the ARC find it difficult to hire and retain staff due to the low wages. This causes huge wait list. We have a wait list of over 100 individuals throughout the Central Valley. And there are other programs that have even larger numbers than ours, and that's really concerning. One of the main reasons, again, goes back to the staffing. If there are wait lists, then that means that there are folks at home that are not getting the services and care that they need. I get calls from parents on a daily basis saying when can their loved ones start? And so it really goes to the hiring crisis that programs like the ARC are facing. So again, it's really concerning that they're at home and not getting the services. And this is while other industries such as fast food receive increases. Again, very concerning to us. We are working with some of the most vulnerable citizens in our community. And it's very hard to comprehend how our staff that are working with these vulnerable individuals are getting paid less due to the wages. They're getting paid less than folks that are working at fast food. I am here today, like many others, to let you know that rate reform is a must, and I thank you for your time.
Thank you very much. Name and affiliation, please.
Mr. Chair and staff, my name is Jordan Lindsay, Executive Director of the ARC of California and the ARC and United Cerebral Palsy California collaboration. As Tony mentioned, thank you for weathering through this long evening with all of us. As you know, there have been hundreds of people here today and thousands more watching at home, and I believe the reason why is because there is shock and dismay that Governor Newsom wants to cut $1 billion from Californians with developmental disabilities, their families, and their workforce. There are already thousands of individuals on wait lists, as you just heard, not receiving the services or any services that they need. This cut would cause immediate and direct pain to people with developmental disabilities, so why would Governor Newsom and his administration aim their largest single proposed cut in his entire January budget at this community, at Californians with developmental disabilities? Mr. Chair, we are very grateful that you and the members of the committee have already stated that you are opposed this proposal to cut. And I understand your desire for alternative solutions. We believe, however, that our community has suffered enough cut after cut. And on behalf of the ARC and United Cerebral Palsy California collaboration, we are not willing to negotiate on any other cuts and enter any solutions, conversations about solutions that involve any cut. Additionally, I just wanted to discuss two items that was handed out to you. One is we're talking about $1 billion around rate model implementation. Just in case you may not have seen what an actual rate model is, I presented one to you, and it just happens to be respite, agency respite, which was just talked about from the members of California Respite Association. I highlighted for you that it's January 24, and I highlighted for you that the direct care staff hourly wage inputted on the rate model is $15.33 below California minimum wage. So you can understand why rate model implementation is so critical, because we are already far behind. Finally, my last comments are on behalf of the Lanterman Coalition. As a co-chair of the Lanterman Coalition, you've heard from my other co-chairs earlier today. You've also received, on behalf of the item discussion on the Master Plan of Developmental Services, a letter from the Lanterman Coalition, which is a statewide coalition of associations and organizations. And I will only read the highlighted portion of it, which is all efforts and recommendations out of the Master Plan on Developmental Services must be predicated on an adequately funded system of services and supports, which includes full implementation and regular updating of the DDS rate models. The master plan process should in no way delay or reallocate, that's important, or reallocate these promised investments and their intended purpose. Thank you very much.
Please.
Hello, my name is Stephen Jackson. I'm the Executive Director for Newton Support Services, based out of the Redwood Coast Regional Center catchment area. so I just want to ask, are you familiar with Maslow's hierarchy of needs? Okay, so that's going to kind of be my baseline for the rest of my talk here. Before I was able to come inside the room, I was walking around the hall and talking with different families and different providers and stuff, and I was met by the executive director for the regional center, for Redwood Coast Regional Center, and even given the serious tone of what today's meeting is about, she was out there networking and collaborating with different providers and different families to find out how to be able to bring more services, specifically to be able to meet the needs of our minority populations in the Redwood Coast. So I want to say I've been hearing these undertones that there's not collaboration and things aren't working within the regional center systems, but that's here today. That is growth and that is connection, and those are things that happen on a daily basis for what I'm used to with working within the regional center system. Now, the hard part about this is, just like going with Maslow's hierarchy of needs, as I'm talking to her about bringing in potential services for an assessment van to be able to go into minority communities and be able to bring the psychologist to the families and stuff, I have to hesitate, and that's not in my nature to hesitate, but I have to wonder, am I going to be able to afford to put this program into place? Because there was a promise that there was going to be this funding available, and can I believe that that funding is going to be there, when I actually go to put these programs into place? I have been in this service industry for 19 years now. I've worked everything from the DSP level up through different managerial positions, all the way to my executive director spot that I have today, and I'm not going to quit anytime soon. But what I have seen during that time is I survived the recession, which saw rate cuts for vendors, and I watched as champions left the field during that time. I survived median rate implementation, because at that point in time, we wanted to make our organization more person-centered, so we made sure it was written into all the language and our mission and our vision. But at that time, we had to re-vendorize, but that meant cut your rates. I believe so strongly in what it is that we were doing with our mission that we went ahead and went forward with that as well. But again, that meant champions were leaving because I couldn't afford to pay people at the rates that they need to be paid. So now I'm looking at this rate stay, whatever you want to call it, a push out until next year, and I'm wondering how many more champions are we going to lose? And then I look at the people that we're supporting, and I'm wondering how they're feeling at this point, because if I'm hesitant in knowing that my foundation is firm, I have to wonder if they're looking at their champions walking out the door. And when I say champion, I mean the direct support professionals that do 99% of the heavy lifting in this state, and being as understaffed as we are, you have, what were we at, 60% of the workforce for what's going on right now, and they're carrying 120% of the workload. And they keep on walking out the door in droves because we can't trust a system. And when we talk about you can't trust the regional centers, you can't trust this type of stuff, we can't trust that a promise is made that funding is going to be in place to be able to put these programs forward to meet the needs through the Lanterman Act, the promises through the Lanterman Act. But that comes from a state level. And when we feel like we have no control over what it is that's going on, even though there's verbal promises, there's written promises when it comes to our contracts, there's all these things, but we don't know, we can't trust that that's actually going to be there tomorrow when we actually need it, when we need to make our payroll, when we need to contract out, when we need to do whatever we need to do. I don't know if the funding is going to be there in 6 months. So that's where, again, I appreciate that you guys are against the push out of the implementation, but I just say, mainly I guess my point was I want to speak to the behalf of there isn't conflict as far as I'm concerned. I've worked really well with the regional centers. During COVID, I was the chair for the vendor advisory committee, and we had, during COVID, 140 vendors on a call once a week to be able to get the information that was coming in. Regional center put in 15, 20 staff at every single one of those meetings, just to make sure that everybody was educated, everybody was informed, we're all on the same page. That's collaboration, that's dedication, that is not a broken system for where I'm at, that needs to be invested in, and it needs to be fostered, because that's how you get trust.
My name is Jim Frazier. I'm the Director of Public Policy for the ARC of California United Cerebral Palsy Collaborative. Dr. Jackson, I can't thank you enough for holding this very important hearing and your statement today about that you will reject the governor's proposal. You are a champion for this community, and I thank you. As the former chair of the Select Committee for the Developmentally Disabled in California, in this House, your consultant, Director Bargeman, and I worked very hard to get that rate study implemented. Very hard. And now we have a broken promise that the administration wants to do. Promises made should be promises kept. As has been stated, people have made commitments to their staff, to programs, to consumers, and now we got to renege? You talk about trust. This is why this system is mistrustful. All the rate freezes from 1998, the cuts, never restoring. And then we had hope. We had hope with the rate study. But if you take and think about it, the rate study's delayed from the time that we decided that we needed it. There were several billions of dollars that didn't go into the system because we were studying what was needed. But we knew what was needed. Dr. Jackson, you ever see the Green Mile? Absolutely. I'm tired, boss. I'm tired of the ugly. I'm tired of having to fight for this community. I need you to be the warrior. I'm going to hand you the torch in the assembly for this community that I carried. I need you to be that warrior. One of the things that we haven't acknowledged, sir, is we haven't looked at what would be an additional or substantial revenue augmentation. We've always looked on cobbling things together out of the general fund budget, but one of the things this does is we overstep the federal match of almost $500 million. No business in the world would ever give up a match. It's ludicrous to think that you would give up $500 million. That's stepping over a dollar to pick up a dime. Now, when we talk about additional revenue sources, we can talk about different kinds of, would have been really great to be included in Prop 1. But again, our community was forgotten about. We're always forgotten about. MCO 2.0 maybe, talking about maybe some kind of revenue sharing kind of agreement, sales tax, even a ballot measure. The California public, if they knew how our population was treated, would jump on the bandwagon to be part of helping us. We can't keep doing this cycle, this roller coaster of going over and then cut. Well, we'll give you a little more, then we're going to cut again. We need a sustained funding source. Something like, and I'm not using it as the example to follow, but Prop 98 for education. Okay, it's a baseline. We need a baseline. We have never factored in inflation in the rates. We have never factored in population growth. I think it said that they were going to be at 31% growth factor. Now, I looked in the Welfare and Institutions Code. In 2022, the Department of Developmental Services said that they needed to add 33,000 DSPs and 5,500 service coordinators by 2025. How's that going to happen with a delay or a cut? We can't do it. We're going to have an exodus of this workforce, which we already have relegated this workforce into a poverty situation at minimum wage. Some are working 2 jobs just to make ends meet. Some are on state aid because they can't make ends meet at this wage. Dr. Jackson, I need you to stand up for these people, be the champion, and let's make change. Thank you so much.
Thank you very much. Really appreciate it. Seeing no other public comment, I want to thank everyone for hanging in there. I want to thank our panelists. I want to thank administration, committee staff, sergeants, LAO, everybody who have participated in this. This is certainly going to be a rough year, but I know we'll get through this together. Thank you, everyone who shared their stories. Every single one of you, your story, your lived experience is absolutely important.
and vital as we talk about the various issues that the IDD community is facing. So just know that your testimony and your time here was not in vain, and we're going to make sure that it was not in vain as well. Thank you all for being here. We are now adjourned.